My name is Dr. Vikesh Tahiliani. I'm the Vice President on the Care Transformation and Innovation team at HCA. We've launched a solution called Augmedix Go ED, which is an ED solution focusing on our providers, so our physicians and APPs at 4 hospitals at HCA. It's a technology that allows a provider to capture the conversation and turn that conversation into a medical note. All of this is done through ambient speech recognition technology, natural language processing, machine learning, and the use of LLMs through generative AI to compile that note. Once that note is created, what the provider then does is edits the note and signs it, seeing the providers get their hands on the technology and them providing the feedback to us, explaining, how they had more time with the patient at the bedside, how they had more time to focus on concerns of the patients, how the documentation helped actually capture pieces of the conversation that they may have otherwise overlooked. As with any pilot, we started small. We started with 1 provider, then expanded to 10, and now we're at the point where we've expanded it across the ED at 4 facilities, and we are actually setting an expectation that anyone that is working a significant number of shifts at any of these 4 facilities use the technology. The good is that the providers are once again finding the technology very easy to use. The training lasts anywhere between 5 and 7 minutes, and they can be off and running. I know many of you, when you first got your smartphone, you didn't really read an instruction manual. You just took it out of the box and started using it. It's almost that simple to use the technology that Augmedix has created. The other thing that the providers like is that the documentation is created in real time. So, just to give you some general sense of what real time means is from the time that the encounter is completed, a note is available for the provider to edit within somewhere between 45 seconds and a minute. So by the time the provider gets back to their workstation, there's a note that's ready to use. And we've heard from several providers, this is really helpful, especially in the EDs that are very busy, because providers say they just bounce from one room to another room to another room. And they tell us that after they've gone to see 3 or 4 patients in a row, it's very comforting to know that when they get back to their desk, they don't have to start writing notes and recalling what patient said what. The notes are just generated and there for them to edit and sign. The other big win, and this is a little bit of an unexpected win, is that the quality of documentation is actually quite thorough and complete. A lot of times, as I mentioned earlier, when providers are bouncing from room to room to room, there's a tendency to just write down the facts that you remember. With the use of the AI and the LLMs, the notes are actually coming through with all the pertinent information, helping the provider create an accurate differential diagnosis and make decisions appropriately. Another win that we did not anticipate is because the documentation is so complete and because we live in a day and age where patients have access to their records real time, the patients are also able to see and see accurately that, hey, the conversation that I had with the provider has been accurately reflected in my patient portal. We've had this live now for a few months. So far, we've generated over 2,800 notes in our EDs, and we've just recently announced the expansion across these 4 EDs. And what that means is that we're asking all providers to use it on most of their patients every shift that they work. And the reception to that by many of the providers has been very positive. To date, our acceptance rate from patients has been above 99%, which is amazing. That means, number one, our patients are well educated on what's going on in the technology space. But number two, they're willing to let technology help in the creation of the note, because that means that the provider will get to spend more time with them. The decision HCA decided to partner with Augmedix was probably based on 3 or 4 very important factors. First and foremost, Augmedix has an excellent team to work with, not only on a personal level, but from an experience and skill level. So we were very confident in that. Augmedix was willing to enter the ED space with us, which is a very challenging space to enter. As you can imagine, in the emergency department, there are bells and whistles all over the place. Noise is a problem. There are patients in hallways. There are a whole bunch of factors that make this an extremely, extremely difficult environment to use ambient speech recognition. And especially when you're trying to have a provider speak to a patient and you need that information captured, otherwise the AI is really not going to be able to generate anything. Augmedix was up for the challenge, and the joint thought process between Augmedix and HCA was, if we can solve this problem in the ED, any other care setting will be relatively simple. If we move to the inpatient side, or Augmedix already has a large footprint on the outpatient side, we're going to be able to move much more quickly. The last thing, another important reason that we decided to partner with Augmedix was that Augmedix was willing to co-develop with us. So what that meant was, we didn't have to take Augmedix's out-of-the-box product. HCA wanted certain things customized, and Augmedix was willing to co-create, co-develop their solution so that it not only satisfies their needs as a company in this space, but also satisfies HCA's needs. As we look to the future of what ambient speech technology can do for us, it's basically limitless. There's a lot of ways we can improve notes, but what we're looking for on the HCA side and the Augmedix side is, let's go to the next level. Okay, it's fine. We created a note and we got better at the note, and now we have a high quality note. Well, what are the other areas that we can make providers' lives easier as they care for the patient? And that was another really, really appealing thought, a joint thought process that we had with Augmedix,